Hi, I'm Molly Marsh, AMR's Director of Education and Engagement Design, and it's my pleasure to welcome you to our next installment of the AMR Meet the Expert series. As you can tell, we are joining together virtually. In this time of the COVID-19 crisis, we are certainly working, as many organizations are, virtually, trying to work towards the mission of our associations and serve in the best way we can, while also learning new tools and looking for new opportunities in how we serve and how we engage with our population and our audiences. So we're going to try our first virtual interview with Meet the Experts, and I am very, very pleased to be joined by Delphine Tanner, one of our conferences and events managers, to talk about continuing medical education and healthcare association meetings. Delphine, thank you for being here. Thank you.
Thanks, Molly.
And let's get started by sharing just a little bit about your background and how you got involved in healthcare meetings to begin with.
Absolutely. So I've been planning at medical meetings for about 17 years now. I was initially introduced to a nonprofit multi-specialty foundation that hosted an annual continuing medical education meeting in Las Vegas.
Nice. And why in your experience do you feel like continuing medical education is so important for healthcare associations?
Well, historically, continuing medical education, CME, has been focused on strengthening the knowledge of physicians and other healthcare providers, also known as HCPs, in their area of specialization and or practice. I believe that associations play a role in advancing medical education each and every day. They are a critical provider of this education for individual practitioners and play a significant role in keeping practitioners up to date in recent developments in their field. I must say I'm very fortunate to have had the opportunity to work with several organizations now whose educational events are designed to facilitate interaction, cooperation, and shared knowledge that aid current medical practitioners and students in their quest to provide the highest level of care to their patients.
That's wonderful. And obviously it's critically important, but what would you say is the biggest challenge in terms of putting together a successful continuing medical education program?
I would have to say that the most challenging aspect of developing an effective CME program would be providing education that works for the entire team, medical team that is, that treats patients, not just physicians, but nurse practitioners, registered nurses, physician assistants, all healthcare providers.
So important that everyone comes together in that way. Thank you so much for sharing your expertise with us today, Delphine. Thank you for being here, and thank all of you for joining us as well. We look forward to seeing you on the next AMR Meet the Expert series video.
Thank you, Molly.